This is the Late Late Lunch Show with Rod Maxwell, supported by
Childbed Learning in Nature's Playground.
So today on the Late Late Lunch Show, we're continuing with a series of conversations we've been having over the last year or two about the care of our parents, our elderly ones, people who need care, either at home or other facilities, and what's out there. And I actually find that this has been a personal voyage of discovery. Maybe I'm doing it for myself, maybe I'm doing it for others. But today we're speaking with Abrar and Vicky from Radfield Home Care, and these guys look after the Altrincham, Sale and Trafford area. Good afternoon, guys. How are you both?
I'm absolutely fine, thank you. You?
I'm very well, thank you. I'm
Well,
very
thank
well.
you.
So just basically, Radfield Home Care as a company is nationwide. Is that right, Abra?
That's right. Yeah, it's Radfield has been around for about 40 odd years. It's all over we've got branches all over the country, but this is the first time that we have opened one in the Altrincham, Sale and Trafford area.
Ah, okay.
So we have branches all around. Yeah, so like Liverpool, nearest one's Chester, Cheshire, and the Yorkshire areas.
And am I right in saying that one of the premises of Radfield Home Care is supporting people in their own homes as opposed to residential care?
Yeah, that is really is what we're trying to achieve, because a lot of people, they want to remain in their own home. They want to be able to be around familiar environment. So yeah, you've got people that are married, couples that want to stay together. People that have animals, and people that are engaged in their local community and they want to remain a part of their community. So we can really help to support people to continue to do that.
It's a massive jump from the point in when you're very self-sufficient, either as a couple or as an individual, to that point when you are either recognize yourself or somebody tells you, look, you need some support here. That's a massive decision for people to go through that, isn't it, Vicky?
Yeah, it is a massive decision, and a lot of people don't want to initially admit that they need care. So it's about how we broach getting that care, making sure that it's done in a really supportive way, and rather than overfacing people with what we can provide, it's about starting off with very small steps. We can start off with doing companionship support, going round, getting to know people. And as they start to trust you and start to see, actually, the really horrible myths that sometimes can be there for home care, actually, this is actually working in my benefit, then people are more likely to increase care. But we also are opening a daycare service in St. Louis on the 8th of September. And that's a really good way for people to start getting involved in that kind of support, getting to know, because it's our workers are working within this service, and coming and getting to know us and starting to develop those relationships with us, really. But yeah, it can take a long progression for people, from the point of starting to see the need care to getting to a point of accepting it. So yeah, it's got to be done in a really, really very clear and settled way, really.
And Abra, as the director for the Altrincham, Sale, Trafford region of
Yeah.
Radfield Home Care, I guess you've got a balance between you're running a business, but ultimately it's care for your clients, if you like, and that's a balance that you've got to work really, really strongly with. How do you do that? What's the core principle of Radfield Home Care, if you like?
So for me and for Radfield, our motto is to help the nation age well in their homes. So that's what we aim to do, help them stay connected to the things that they enjoy the most. So from running a business point of view, it's making sure that we offer the clients comes first as well as our carers. So it's making sure that we offer a premium service, which is what we are known for, and making sure that the clients and the calls and the service that the client gets is of a premium service, which is reflective on the business as well, which is what the Radfield brand stands for, really.
Great. We'll take a break and we'll be back with Vicky and Abra talking about Radfield Home Care and the services they provide in a couple of minutes' time.
You're listening to the Late Late Lunch Show with
Back to the Garden Childcare, where little explorers grow naturally.
So today on the Late Late Lunch Show, we're continuing our exploration into the types of services that are available to people who need support in their home. And I guess, Vicky, there is there a specific age range that you look after, because you could be somebody who's easily in the retirement age. You may have somebody whose circumstances mean they are younger and they need support. Do you find that you're working with a certain demographic in terms of age, or is it quite broad?
Obviously, yeah, a majority of the people that we support are of the older age bracket, but no, we provide support from anyone from the age of 18 upwards, because, people can be faced with lots of different things, and they can be, means that they require support. I mean, it can be a range of different, massive amount of illnesses and things that we will support people through. It's just as long as we're making sure that we're enabling people to live as independently as possible. We've been in contact with the Stroke Association recently, and they were saying that the actual increase of people having strokes in the 40s and the 50s is actually on the increase. So yeah, we're open. It isn't just for people with dementia; it's people with a range of illnesses that just feel that they need that support. And some people, it could be mental health that they need that support, and that's where a lot of the companionship kind of support can come in, because we can be helping people get out, stopping social isolation, getting them interacting with groups and activities. And from our travels around the area, we've been connecting with a lot of groups and societies in the area, and there is a massive range of things that people can get involved in. Things it's opened my eyes as to the groups. So it's about making sure people are staying engaged with their community, no matter what their illness or disability is.
And one of the things I like about care in the home is that, based on my limited experience and knowledge, is that you can sort of start with a basic package, and as needs change or whatever, so you can get people used to even just having somebody call in and get used to that. And then if needs must, you can start to ramp that up. Is
Yeah.
that the way you guys look at home care? It's like a series of steps, if you like.
Yeah, it is. It is very much like a series of steps. So yeah, a lot of people, become involved within home care by having like a companionship support. So it may be that you just want an hour's support just to go around and just to have a chat with them. That could be increased, further. And then, it can then continue to then with putting in, numerous calls a day, checking on people's safety, doing personal care, helping with meals, assisting them with the shopping, cleaning, anything like that. And then we go right the way through to what we refer to as living care, and that's when somebody is having support within their home with a carer 24 hours a day. So people tend to have two carers that work with them. They work 2 weeks on, 2 weeks off. And it's about they can then stay in their home. You've got that one-to-one support because you've got that carer that's there for you all the time. And it just means that you can still engage, and that what if you go into residential homes, sometimes people they lose contact with a lot with regard to the community. Where if you do the living support, you're maintaining that community link. You can still get to your groups. You can still keep up with all your hobbies and activities, and keeping people's skills, because obviously we want to maintain people's independence. So getting people's we're not in there to do their cook and do the clean. It's about supporting people to continue to do it for themselves, and supporting them through that. So, it's a really good way for people to still get that level of care and everything that you can get within a residential home, like access to your district nurses, GPs, podiatrists, your eyes tested, hearing tests. They can all be done in your home. And so there's no reason why people need to go to residential care if they don't want to.
Do you, I mean, the relationship that a carer has with the person they're caring for is very, very key. And what I'm interested in is whether it's just dropping in for a bit of social support, if you like, to the point where you might be offering that live-in service. Do you look at the characteristics of the person and try to map
Yeah.
the carers
Yeah, well,
to them?
you'll do matching. So you'll be making sure that you'll be looking at, carers, and I've got like interests with the people. And if you're going to be having living care, without the person that's getting the care being involved in that, recruiting for that person, to make sure, because obviously they've got to live in that home with that person, so they've got to be able to get on. And so they'll be involved in that. They'll be involved in getting that person in, so they know that that person that's coming in, they've got that, can have that relationship with. They've got joint interests. They like the same things, so it just makes it so much easier for the person.
We'll take a break, and we're talking to Vicky and Abrar from Radfield Home Care. They're just starting to support people in the Altrincham, Sale and Trafford area, and we'll find out more about that, and also the daycare services, which are starting in Bowdon at St Luke's, with them in a couple of minutes' time.
You're listening to the Late Late Lunch Show with
Back to the garden childcare, where little explorers grow naturally.
It's Rod Maxwell on Radio Alti, and today we're talking about home care. We're talking about looking after people in the community who need some support, and we're talking about specifically doing that in their own home through Radfield Home Care. And I'm speaking with Abrar, who's the director for the Altrincham, Sale and Trafford area, and Vicky, who's the manager of that area. Now, I'm thinking about, if I'm somebody who's in the market for this type of thing, if it's somebody who has a lot of clinical needs as well, how I take it you don't do the clinical side of it. That's where the NHS would still support that. So how do you match your ability to take on a potential customer or client, let's call it that?
Yeah, so we would work with, the local healthcare professionals. So it could be that we're working with district nurses, we're working with physio teams, we're working with assaults teams, and they would provide the guidance. Our staff get extensive training anyway within a lot of healthcare needs. Obviously, they're not medically trained, but it's making sure we're maintaining those good relationships with our external partners, really, and making sure that we're keeping up those communications with each other. We know where we're at, and we know what we need to be doing. We're following their guidance, because there's some levels of support we can do, and we can provide medication administration, and we can be trained to do things like taking blood sugars and doing blood pressure checks on people. Those kind of things, we can have training in that. We can do peg feeding with the right training. So it's just about making sure that we were just working with those community partners, really, and just making sure we're following their guidance. And if we've got any kind of concerns, we just contact them. They just would come out, which is exactly what would happen in a residential home. In residential homes, there's no medical trained staff within them either, so it's no different to that, really.
Yeah, gotcha. Now, Abra, the one thing I've always found about today's society is that we have technology that allows people to communicate, engage with each other more. But certainly those people who are in the late 70s, early 80s, weren't, for them, technology wasn't an easy adoption. I imagine that whether it's somebody who's coming in for an hour visit to somebody who might be staying with you, what they can do is help you also with use of technology. It could be as simple as using the NHS app, or it might also be doing home shopping. Is that something that you're finding you help bridge that gap for your clients?
Yeah, so our carers, when they go around, and depending on what the client needs during their visit, if it's a short visit, if during that visit they want help with reading letters, replying to emails, or that type of stuff, getting online, our carers can help them with that, as long as they also know how to do that stuff themselves. Yeah. Obviously, they can help to a certain degree, and we can also, if they needed to do any other stuff like banking online, perhaps sort of guide them on how to do that. But during our daycare and other, when we have our daycare, we'll be looking to sort of get some people that are tech savvy, sort of give people, the members, a training on that sort of type of stuff. So reach out to people that provide that sort of support, where they kind of come in and sort of go through the basics with the members on how to get online, be safe online, be aware of scams and all that stuff. Coming from a professional or someone in that area would mean a lot more to someone, so they have the expertise in that area as well.
We're going to take a break, and I want to ask you a couple more questions about home care, and then we're going to talk also about the daycare service that you're starting up here in Bowdon at St Luke's as well. So today, I'm speaking with Vicky, who's the registered manager for Radfield Home Care across Altrincham, Sale and Trafford, and Abra, who's the director of that business. We're talking about care at home. We're also talking about daycare services, and we'll get onto that in a couple of minutes' time.
You're listening to the Late Late Lunch Show with
Back to the Garden Childcare, where little explorers grow naturally.
You mentioned something to me there that reminded me that trust is a huge part of the relationship here, because if you are somebody, it's whether they're coming in for a couple of hours or they're staying, you've got access to information about your clients, about people that actually could be used in a subversive way, if you like. So you're talking about banking and that type of thing. How do you make sure there's no issues with that? That the privacy and the privacy, the privacy of your client is maintained, and because that must be when you're in their house, that must be quite a delicate situation.
It is. I mean, initially, all staff have got like DBS checks. They've all, to make sure that there's nothing that would cause us any kind of alarm, and because there's nothing that the police are investigating. But then, after that, part of the training that we do is all around confidentiality. We're bound by the same confidentiality that any healthcare professional would have, and so we're not to be discussing, and it's making sure that the information that we do have is what we need to know. So it's making sure we're not having sake. So, for example, if we're not there to be doing people's banking, then we don't do banking, and we would ask permission. If that person can't give consent that we're supporting through dementia, we'd be going through family members before we would do anything. So it's about being. And then I would be saying, if staff are using money that, we're getting receipts, we're getting those it's very, 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 very set. And then myself as a manager, one of my roles is I audit it. I make sure that everything is above board and that everything's accountable for, really. So I'd be going in and I'd be doing those auditing on the staff and what they're doing, and making sure that everything is above in order. So, that's part of what our compliance checks are.
So it's obviously something you're all over, basically. Vic.
Oh, yeah, yeah. Yeah, we have to, constantly, we're constantly checking, and DBS checks are done every couple of years as well. We have to renew, so it's not a case of a DBS is done and then it's never checked again. We have to constantly be checking DBSs every couple of years just to make sure that, something's not going on in the background we need to be aware of.
And can I ask, in terms of if you have the maximum amount of home care service, like you've got somebody staying on that 2-week rotational
Yeah.
basis, are they going with you to doctor's visits if you have to attend the GP service? Are they
Yeah,
going
everything.
to the local shop or whatever?
They're doing absolutely, yeah, they're doing absolutely everything for you. And so they're doing all that support. They're with you that 24 hours. What they tend to do is they tend to do 22 hours, and we have to give them a 2-hour gap every day.
Come on.
But then what normally happens is a family member would just either go and sit with them for that 2 hours themselves and provide that support internally, or they could commission one of our visiting supporting team to go in and just do that 2-hour support with them. So we tend to do that. But with regards to that living carer, yeah, they go into appointments, they go into the shops, they're doing everything with
And
that
and
person.
and routine's really quite important to a
Yeah.
lot of people. It's massively important to me with my memory
Yep.
loss. But so I guess it's also maintaining that routine for somebody, which also means that they maintain their social links and their social
Yep.
circle as well.
It is definitely. It's really, really key. And all our care packages are person centered around what that person needs, likes, dislikes. So no care package is ever the same. Because everybody, so the joys of us all being human, we're all different. So those care packages are really, really tailored to that individual, even down to the visiting support that we provide. We would be working at making sure we're going to people at the times that they want. So, if you don't like getting out of bed till 10 o'clock, then we're not turning up at 7 o'clock in the morning because, we've got sickness and there's a gap. We're making sure we get into people at the right time. We pay our staff travel time. So they can give the people the full, if somebody's got an hour support in the morning, we can give that full hour because the travel time it takes them to go from the next one, we're paying that staff member for that. So the staff member's not out of pocket. If it's a 15-minute drive to the next person, they're not out of pocket to get to that drive.
And what you mentioned there about the time that you get up, that's actually hugely important, isn't it? Because
Oh,
you
definitely.
often hear about these services where they're in there at 7 o'clock in the morning, which means it's a hugely long day for somebody who may
Yep.
not be out and about. And actually, a lot of them, I mean, my mum likes to sleep in these days.
Yeah.
And so having the ability to do that just makes it feel a little bit more normal, doesn't it?
It is, and we shouldn't be, telling people how they should be doing their lives. It's about them continuing in. I'm not somebody that would want to get up at 7 o'clock in the morning. I wouldn't be happy. And the really key thing that we tell ourselves all the time we're having our care is the care that we provide would I give that care to one of my loved ones? And if the answer's no, then you need to be looking at what you're doing wrong. It's got to be, everybody's got to be treated that with that in mind. Would I want this care for my loved one? And that's what we're striving for at all
And that,
times.
that is the acid test, isn't it?
It is definitely.
It's what makes us human. We'll take a break. I want to come and talk about the daycare service, the Radfield Club, which is starting at St Luke's in Bowdon, and because that's a different strand of help, and it could be the start of something. But we'll speak with Vicky and Abrar about that straight after this break.
You're listening to the Late Late Lunch Show with
Back to the garden childcare, where little explorers grow naturally.
So today on the show, we're talking about the care of people in our communities. Often it's the care of our loved ones. It could be people of a range of age groups, but typically, I guess today it's mostly people who are in that sort of 70 plus type age group. And people are certainly living longer with advanced healthcare. But we were talking about the home care, and of course, there's a range of that between an hour visit to somebody staying in your house. The daycare service that you're starting in Bowdon, what will that offer and how's that going to work?
So it's initially going to be on a fortnightly basis. So it's got on a Tuesday. It launches on the 8th of September at St Luke's in Bowdon. And it's about providing people with that social support. So we were doing activities. We'll be looking at those activities being whether it's crafts, whether it's, playing games and that kind of thing. We're looking at doing some like physical activities. We've got chair exercises. We've got games that involve a little more physical to keep people moving. We provide a two-course meal in the afternoon, and then, we'll be looking at, people coming in. So it could be that when we have a singer that comes in, and we have got local professionals in the area. So we've got like a podiatrist that is gonna come in and look at things like foot health. We've got my brain went blank. We've got like lots of different people coming in. So there's a solicitors in Hale called Blackstone's there. We're working with them, and they've said about doing, maybe a free initial consultation for people to discuss things like LPAs, wills, probate, all that really lovely stuff. So yeah, it's just about providing people with an all round, but it's about people getting out, getting that social support. The luxury that we have is because we're a regulated service, so all our staff have got high levels of training, and they're going to be working in the day centre. So, when it comes to things like providing that personal care, providing that food assistance that people may need, we can do that. So, a lot of people that don't feel that a day service is something they could access because of the care needs, that's not going to be it for us because we can help people provide those services, and it's providing respite to carers because they've got that peace of mind that we can be looking after their loved ones, which then gives them 5 hours to be able to go and do something that they enjoy that isn't caring, and it just helps prevent carers burnout, which it's such a difficult job being a carer, and it's about providing that support for them as well.
Yeah, I can imagine. Is this something that Radfield has done elsewhere in other regions then, Abra?
Yes, it is. It's something that Radfield promotes across the network. So if you go to any Radfield anywhere in the country, they'll also have a day Radfield Club as well. But depending on their areas, they may have it on different days. But everyone will have one.
And Vicky, so it's going to be on a fortnightly basis. When
Yep.
did the Radfield Club for Bowdon at St Luke's start then?
It's the 8th of September, so we're saying that the first one is a free service for people to come. Just for numbers, we do need people to let us know whether they're coming. And then anybody that is interested and wants to sign up to continue coming, we're doing a discounted rate for the 6 weeks after that. Once a club is up and running, we are offering like 2-hour taster sessions. So again, if somebody is thinking about coming to us, they can come in, and that's a free of charge thing. They can just come in for 2 hours and just have a feel of what it is. We are limiting the numbers in the clubs. We don't want it to be massive. So we're looking at capping it at 15. But then if it does become popular, we can look at doing alternate other days. Going weekly is one option, and then just doing more days a week.
Yeah, and I can imagine if it does take off and people are getting companionship from it, and also maybe even creating their own little groups around it, hobby groups or
Definitely.
whatever, and then it could easily become something that generates into a weekly meetup, really.
Yeah, and like I say, Trafford is such a big area, and our network is the entire of Trafford. So, as services kind of grow, it could be that we look at, a daycare service in a different area of Trafford, just so it's easier to be access. But it's all like a working thing we've got at the moment. But yeah, our main priority is the 8th of September and getting that off to a really, really good start. And we've been to quite a few of the day services our other providers, other networks have got, and they're really, really well attended. They're really enjoyable. People really do, benefit from going to these things. So we're just really excited to get that going.
And what sort of charge are you envisaging that to be on a weekly or whatever basis?
So the charge for the daycare is Radfield Club. Considering it for visiting care from private home care start about £38 upwards for most providers. The charge would be for initial first 5 weeks £60, and then following that it'd be £80 for the day. So you would get 5 hours of care and plus a 2-course meal as well while you're with us. If you've got more sort of specialised needs, prices may vary, but it just depends on an individual sort of circumstance, really. But
Okay.
that's the ballpark figure, roughly.
Okay.
Also,
Okay.
and I just mention on that as well. You may have seen this on the social as well. But we are also giving our lovely Ruben Radfield Bear away as well, raffling him away on the 8th of September as well. So if you haven't got raffle tickets, make sure you get them because they'll be raffled away.
What's that for, Abra?
So that's for we call him our not a mascot. He's our colleague now. So he sits in our office now. He's about 1.5 meters tall. He wears a Radfield t-shirt, so he's called Ruben. He's our Radfield Bear, and we were partnered up with the Northwest Hearts charity. So the money that we get from the raffle will be given to Northwest Hearts charity, and the lucky winner will be taking a Ruben home, or a similar Ruben, because this one looks a bit worn. In nice terms. So there'll be a lucky winner as well on the 8th of September as well.
There you go. So Ruben the Radfield Bear will get an owner or
Yes.
Anyone that's seen us at any of our other social groups will know exactly who Ruben is. Or if you follow us on our Facebook or Instagram pages, you'll see Ruben because he appears quite a lot in our posts. So yeah, he's definitely a member of our team, and we actually have little smaller teddy bears, which we call our baby Rubens. And anyone that signs up to any support, they get a baby Ruben as like an introductory gift. So the bear theme is following us right the way through.
And who doesn't like a bear? Especially a Ruben bear.
Exactly.
Well, I'm going to take a break and come back and wrap up with Abrar and Vicky. And I want to ask you about sort of the starting packages for home care visits, because we've talked obviously about the daycare service, and then find out how people can find out about you and get involved in your socials, etc. So today we've been speaking about home care. We've been speaking about Radfield Home Care, a new service that's coming Altrincham, Sale and Trafford through Radfield Home Care, and we're talking to Abrar, the director of that franchise, and Vicky, who's the registered manager, and also the daycare service at Bowdon St Luke, starting on the 8th of September. We'll take a break and then we'll wrap up with them in a few minutes' time.
You're listening to the Late Late Lunch Show with
Back to the Garden Childcare, where little explorers grow naturally.
It's Rod Maxwell on Radio Alti, and today I've been delighted to. I often find that I'm doing these interviews and I'm finding out so much more. It's almost like personal research for myself, actually, because it'll not be that many years before I'll probably need the same thing. And we're talking to Abrar and Vicky from Radfield Home Care. That's starting up now, franchise in Altrincham, Sale and Trafford, and we're talking about it being home care and also the daycare service, which we just mentioned, which is starting at Bowdon St Luke's on the 8th of September. Now, I need to ask you about the starting prices for home care packages. We've obviously talked about the cost of daycare services, but obviously everything's very customizable. So it's impossible to give a price. But if I was somebody who was needing a visit a day, an hour visit in the morning, that type of thing, what sort of range of price am I talking about there?
So for morning, for like you mentioned there, for an hour visit just in the morning, the prices will start from roughly about £38 for the hour. And that would depend obviously on the amount of that care you need and the needs of the person, but that's what they'll be starting from.
Okay. And I take it that as if you start with that, as you need more things, then you guys come back with estimates and it's all very transparent around the cost of the care.
Oh,
Yeah, everything's transparent. Yeah, Vicky can go over like how that's in more detail.
but yeah, everything. Yeah, as care increases, like I say, these are discussions we have, and even when it comes to that the living care, when you look at the price of residential care, you'll be quite surprised at actually how cost effective it can be to have that living care support.
Yeah,
Especially when you look at all the benefits. So you've got you're paying for one-to-one support. It's quite a surprise when you get people actually inquire about it.
and can I ask about relationship management, right? So obviously you've got a relationship with the person who needs the service, but you've also, I'm sure, got to have a relationship with their family because they
Yep.
want to know what's going on, and
Mhm.
and they want to know maybe even just how's my mum and dad or whatever been, or uncle or aunt or whoever it is.
Yeah.
Have you seen any change? How do you manage that type of thing?
The biggest way is all of our care records go on an app that is called Careberry. So when a carer goes in and provides any level of support, they will be putting information on that as to how that support was that day, how that person was, if they've eaten, is been any issues, and family members get a login, so they can just log in if they want to know how mum is. They just log into that app and they'll get a very straight away clear picture of how mum is. But on top of that as well, it is about maintaining those relationships. So as a registered manager, I'm not just a person that sits in the office doing paperwork. I will be getting out, I will be meeting with people, doing regular meetings with family members, discussing people's packages of care. So, because I think they've got to have that kind of, as well as having the trust of the carer, they've got to have the trust of myself because I'm the person that's, telling those carers what to do. So they've got to know that, as you go further up the ladder, they've still got that trust with us, really. So it's maintaining and just doing those regular reviews with people and, just having those constant chats with people. You may work with people. It's not always that care packages go up. Sometimes care packages can come down, and it's about working with people to make sure that the care that they're getting is fitting their needs at that point in time.
Yeah, I mean, I must say I like the flexibility of this type of service,
Yeah,
but I guess at the end of the day, it's all about care, transparency,
definitely.
and there was another one I was going to mention, but care and transparency and trust. Actually,
Yeah,
I think Vicky, isn't it? But look,
definitely.
if anybody was interested in finding out more about you, where's the best place to go?
You can contact us. Our phone number is 0161 5330344 or drop us an email at altrincham@radfieldhomecare.co.uk. All of our numbers and everything, we're visible on Facebook, Instagram, so you can go on there. We've got a couple of articles that are on our website page, which is Radfield, Altrincham, Sale and Trafford. So go on there, have a read. There's information about myself and Abra, so you can get an idea of what our background comes from. And yeah, if you want to and any kind of question, just don't hesitate, give us a phone call. We do offer free consultation. So if people do want to have a chat about that care, it doesn't cost them for me to come out and have that conversation with them. This is no obligation that they need to be purchasing a service from coming out to see them. But, if it's just that starting track of wanting us to sit down with mum and dad or, and having that chat about what it is we can support and how we can, support them so they can start to see that actually it works out in their benefit. We're not going in there to intrude on their lives. We're about improving it and what we can do. So, just give us a ring and have that conversation with us.
Very good. Well, look, Abrar and Vicky, thank you very much for your time. That's Radfield Home Care coming now to Altrincham, Sale and Trafford through home care and also daycare services. Go to the website. I think it picks up, it knows where you're from, and it automatically then defaults to the Altrincham, Sale and Trafford sort of portion of the website. And there's a lovely video on there also. It illustrates the relationship between a carer and a client, I guess, is the end of it. Right. Well, thank you very much indeed.
Wonderful. Thank you.
You're listening to the Late Late Lunch Show with
Back to the Garden Childcare, where little explorers grow naturally.